Lamblazer. I will be giving my presentation on the substance abuse issue in Philadelphia related to the death toll that has increased over the past couple of years related to the opioid crisis. My presentation is aimed at clients of the Sunrise Detox Center. These are individuals being treated for substance abuse issues, alcohol abuse, or dual diagnosis. Because of COVID, Sunrise is not accepting visitors, so I am making my presentation virtual and presenting it to two nurses who have backgrounds with substance abuse in their families as well as in their chosen work fields. This is, again, like I said, a presentation about substance abuse, especially related to the increasing death toll specific to the area of Philadelphia. I'm currently in the home of one of the nurses to present this project. In a perfect world, I would be at the Sunrise Detox Center giving this presentation to clients of the Detox Center. And my reasoning behind this is because of the opioid crisis and the increasing death toll related to substance abuse. This is a picture of Sunrise, and this is where my presentation would have been held if there was not a global pandemic going on. My name is Lauren Blazer. I'm a registered nurse. Right now I am enrolled in my BSN program at Aspen University. I have been working on this project for 2 classes now. It's been about 16, it'll be a total of 16 weeks worth of work and research. And I am currently employed at Jefferson Cherry Hill in their emergency department. The reason behind my project is I see a lot of patients coming into the ER with substance abuse related issues and chief complaints. I do also interact with some of the clients coming from Sunrise Detox. These individuals present from this institution because they are intoxicated or inebriated, and or they have medical issues that the facility is unable to handle. So they come to me so that we can get them medically stable and back on their way to their rehabilitation. So the statistics right now are intense. As of 2017, 67,367 people overdosed in the United States. 5,388 of those people were living in the city of Philadelphia. That's a 45% of the population. Philadelphia has one of the highest death tolls related to substance abuse. They are ranked 35.1% and the national average is 19.2%, and it is just climbing, especially over the last 5 years. Philadelphia rules the drug-related death rules them undetermined. They're either a suicide, homicide, or undetermined, but they are all as a result of an illicit substance. In Philadelphia, there was a 25% increase from 2018 to 2019 in drug-related deaths. So the statistics are growing, the opioid epidemic is growing, and I felt a need to address this issue, especially with the clientele who is hoping to get help for their addictions so that they don't wind up as a statistic. During my research, I referenced Healthy People 2020. They have a goal to reduce substance abuse, to protect the health, safety, quality, and life of everyone, especially children. Their goal in relation to this Healthy People 2020 was to reduce the non-medical use of prescription drugs. So right now, individuals are using prescription drugs for personal use. They can get them over the internet, they can get them prescribed to them through a doctor, or they can buy them on the street, and they're using these to help their addiction. They are in no way have any pain, and they just use them and abuse them. A second aspect I looked at when developing my project was the core determinants of health, specific to this environment. So social environment, do they have social support? When I interact with individuals coming from Sunrise, most of the time they do come with they're a support person. So that leads me to believe that they have people in their corner, cheering them on and helping them get through their addiction. Some of the people in Philadelphia may not have that. As far as employment and working conditions, there's a majority of these individuals who do not have steady jobs, or they lose their jobs because of their addictions and their use of illicit substances. So that's also put into question. As far as the physical environment, there is a large homeless population in Philadelphia. I did a window survey method through my research, and as soon as you get off one of the bridges, you see individuals coming up to your car with signs asking for money, food, saying that they've been out of work for a period of time. This is one of the concepts that need to be addressed because these individuals also present as if they have substance abuse issues. Their teeth, their arms, they all look like they've had a long history of drug abuse. The biological and genetic services, did their parents use substances? Did they grow up in a household with drug or alcohol abuse? Is it just continuing the circle? Health services, do they know what access they have as far as free clinics and what kind of services these institutions provide, that they can get, their yearly vaccines to prevent the flu, to prevent certain illnesses? And then gender discrimination, especially in the LGBTQ community. These individuals fall back on drugs because they feel discriminated because of who they are, and then they don't access health services because they feel that they'll be judged because of who they are. So my personal story related to this, we're going to call my friend John. He was my roommate and my friend, and kind of helped pull this project together. He was career driven, had military service under his belt, and as of February 26th, I saw him and he looked well. I received a phone call on July 25th that he passed away due to a bad bag of heroin. He had succumbed to his addiction. For the majority of the time knowing him, it was, we didn't know how bad his habit was. From what I understand, we were reaching out to get him help, and he did one last hit, and it was the last thing he's ever done. And he was found deceased in his home. So I want to bring up the fentanyl issue with this. Fentanyl is being added to substances, and it's fatal. If you use a drug that's laced with fentanyl, your outcomes are very, very poor, and the outcomes for you are not going to be great. There's not going to be much that anybody can do to help you to bring you back. This is intranasal naloxone. This is what is being given out. New Jersey recently provided this in grocery stores, pharmacies, and free clinics. You did not need a prescription. They didn't ask any questions. They were just giving it out to help assist the opioid epidemic. So for intranasal naloxone, and as you can see, I created a how-to on how to use this. You just open the package and you peel, push, and press. And this could potentially save somebody's life. So if you come into contact with someone that has recently used, they are labored breathing, they have pinpoint pupils, they're not easily to arouse, meaning you try to sternal rub them or induce painful stimuli and they don't arouse, they're going to need Narcan, or they're going to fall to their overdose. So Narcan, we use it in the hospital, they use it on scene, and it has helped bring people back from their overdoses and prevented death. However, with Narcan, there's a 30-minute window. So if you do use it, you still have to call for help because the individual will again succumb to the drugs in their system. It gives them 30 minutes to get help and get the assistance they need, but 30 minutes after that, if the drug was very powerful, they'll go back into an overdose and then die. So Narcan is very helpful with the situation, but it's not 100%. Any questions?